Hello and welcome everyone. My name is Rami Deeb. I'm the Community and Communications Coordinator at MIT Enterprise Forum, and welcome to the second episode of the Boardroom Webinar Series. I'm very glad, and it brings me so much joy to have with me today Dr. Khalil Ramadi, who is the MIT Hacking Medicine Regional Director in the Middle East, and soon to be the Bioengineering Professor in NYU Abu Dhabi. Welcome, Dr. Khalil. How are you?
Thank you. No, I'm so happy to be here. Doing pretty well. It's early morning still for, well, not early. It's morning for me. I'm still in the States, but I'm glad we could make it work. I'm excited.
Yeah, same here, same here. I'm very excited for today's discussion. It's very eye-opening, and I'm really looking forward to having the people joining us kind of bring in their input and your expertise in the healthcare sector. So just to give the audience today a rundown of what to expect today, we're going to be discussing healthcare and health tech innovations in the past few years and what to expect in the future in terms of innovation, transforming lives, businesses, and in the long run, saving lives. So before I begin, I just want to say, Khalil, 10 years ago, we saw the global financial economic crisis, and that was kind of the boost for the financial technology sector. Can we now say that the same thing applies for the health tech sector within the current COVID-19 pandemic, or like, should we expect something else? Are there any other obstacles? How would you describe the current healthcare system?
I think it's a very apt comparison. I think in a way, the financial crisis that we saw a little over 10 years ago, shook the industry a little bit to its core in terms of having it revisit some fundamental assumptions about how it was laid out and the way it was doing things. And I think this, pandemic is very much causing people to reassess the same thing with healthcare. I think even if you just look at comparison country to country, it's becoming very clear what aspects of some health systems work well and what health systems have aspects that do not work well in this case. And so I think we really are going to see a fundamental shift in a lot of the details in terms of how healthcare is done and how we expect services to be delivered.
Oh, okay. So, but the thing is, actually, my particular question is, for right now, we are looking at the healthcare system from a very holistic view. And if we want to compare geographies, for example, we see that in areas where it's more, quote unquote, developed, more prepared for those pandemics, we see the numbers of affected people very much higher than other areas in the world where you'd expect a more dire situation, for example, in Africa or in places like the Middle East. And some theories come up like, is it because they have some sort of an immunity because of the MERS outbreak back in 2013? Or is there really a public, the role of the public out there kind of affecting the healthcare system and how things are moving?
Yeah, I mean, I think there's a few issues there, right? I think that unfortunately at this point, the best we can make are projections. And I think we have a lot of questions that we do not have answered, kind of like you said, what is the difference in immunity from people to people? I think even if you look within a certain population, you have asymptomatic carriers. You also have people that develop severe sort of respiratory distress, and that's where a lot of the mortality comes in. So I think there's a lot, honestly, that we don't understand. I think to your point about sort of this disparity between developing and more developed countries, I think the one easy answer to give there is also that how well do we know? Like, how broadly are we testing? How accurate are the tests? What are the sensitivity and specificity of them? I think because of that, we're sort of going in, let's just say, with like one blind eye almost. We're still trying to figure out exactly what's going on, how this disease behaves, and why necessarily we're seeing this huge difference. I think the other thing I'll point out is even with similar prevalence rates, we're also seeing a difference in mortality rates between country to country. And I think that is probably reflective as well of what the healthcare system is like, how easy it is for people to access care, and how well supported I think it is.
I'm actually glad that you brought up that the scientific realm is kind of, I mean, one would expect that the scientists would know what they're doing or how the things are moving, but in reality, this is not what's going on. So I'm really glad that you brought it up, specifically because there are many questions coming up about standardizing processes rather than standardizing products. So, I mean, within the COVID-19 outbreak, do we really have the luxury of those, of time at first, and then of standardizing those processes to ensure that the circle is complete and all ends on an integrated level? So if you want to make sure that the healthcare system in Germany is kind of applicable in other areas of the world and vice versa.
Yeah, I think, you know, in an ideal world, I think people have an idea of what the perfect healthcare system would be like. It would integrate data from so many different sources. Different agencies will have access to the same data automatically through electronic medical records that, that hospitals and clinics keep. I think the reality of it is that that's not always the case. I think some countries have, you know, really shown themselves to be leaders in terms of having this integrated data infrastructure where data can be seamlessly sort of pulled from one place to the other, while taking into account privacy concerns and all that stuff. But at the same time, I think some have not. I mean, honestly, just looking here in the US, I think it's extremely disjointed. And we've known this from before. I think every hospital system uses sort of their own electronic medical record. They treat patients a specific way. There's some overlap, there is some conversation, but the interaction between them needs to be intentional, and it's not seamless as I think all of us wish it were, especially when you speak about times of pandemics where it's important to have a really sort of quick, robust, and consistent response.
So, but like right now you're talking about like on an agency level, on organizational level, but what is your opinion on the public's role within that? So we think of the healthcare system as something that comes from the top to bottom, but in reality, it's everyone is a patient at the end of the day, whether it's you're an entrepreneur, you're an investor, you're someone, a regular Joe. So at the end of the day, the public is going to be the one defining how healthcare systems are built and optimized. And where do you stand on that?
Yeah, no, I mean, I honestly couldn't agree more. I think you'll hear me say later again and again that everyone's a patient. And I think that is actually fundamentally a lot of what we do sort of as a group, as Hacking Medicine. I think we try to sort of bring different, honestly, non-medical experts together to try to sort of think about how to tackle different problems in healthcare. So on that front, I think everyone has something to contribute. And if you've ever, even if the only interaction with medicine you've had is to set foot in a hospital once, you probably have seen many things that you think could be improved, and you would probably be right. I think the difficulty with healthcare, unlike other industries, that yes, at the end of the day, we're all patients, but you sort of have these three different players, each with their own incentives. So you have the payers who provide, patients who request, I would say, or sort of are in need of care, and then providers who deliver it. The providers are the ones that usually, with all the know-how in terms of knowing what's a good decision or not, when you go to get a hip replacement surgery, it's not like they bring out a catalog and say, which color hip would you like, or what material hip would you like? It's very much, this is the best for you. And you kind of be like, okay, I'm not an orthopedic surgeon. I'm going to take your advice. And because of that, you have this sort of imbalance of agency. Like us as patients, we lack agency. We're not directly paying for care. And so the impact of not showing up to an appointment, or the impact of saying, you know what, maybe I won't take these medicines. I'll pick them up, but I won't take them. I want to stop taking them. That is, it's not the same way like in traditional consumer tech, where we know what the options we have, we can select, and in a way we can force the market to adjust to our needs by exerting this request. So it's a little bit more convoluted with healthcare.
So from your experience with MIT Hacking Medicine, what can you tell us about kind of overcoming these obstacles in a quote unquote entrepreneurial way in a shortcutting some of these obstacles in a way that ensures that everyone is happy at the end of the day, without compromising any, the scientific method or the financial aspect of it all?
Yeah, I mean, short answer is it's difficult to keep everyone happy, but it's important. I think we see many examples of different technologies and innovations that people develop that unfortunately never get translated, mostly because it doesn't make sense. Not from a scientific perspective, not from a benefit perspective, but rather from a workflow perspective. If you're requiring, I don't know, doctors to take in half an hour more of their time to input this thing so this algorithm can compute the likelihood of you sort of, being discharged today or tomorrow, for example, that's just not going to happen. I think everyone is sort of strapped for time. I think what we try to sort of embody and encourage people to do, and I'll get into a little bit this later, is try to, one, bring different disciplines together from the very beginning. So that means involving clinicians, involving payers, insurers, engineers, designers, coders, trying to bring everyone together from the very beginning in terms of tackling, or analyzing, I should say, first the problem, and then being able to build a solution around the very contextualized problem. And so what I mean by that is, one of the examples I'll give later is that if you think about a problem like people don't take their medicines, right? And, you know, we see solutions to try to solve this all the time. We see pill boxes, you see electronic sort of bottles that have reminders on when you should take your medicines. But the reality is there's many reasons why people might not take their medicines. People might forget, people might not like them, people might not trust them. Maybe they get confused if they're taking many of them. And each one of those has sort of its own approach of how you would tackle it, right? Maybe some people don't take their medicines because they can't afford them. And so they'll, you know, say, instead of taking 2, I'm going to take 1 and just, you know, they'll last me twice as long, right? So I think that empathy is important to build with what exactly is what we're trying to address and fix. And I know that it sort of takes a very narrow view at a specific problem. And then after you really understand it, being able to expand into sort of the broader system. And I mean, the one thing I'll say as a caveat is that in a way, if we had the perfect system from the beginning, we wouldn't be approaching it this way. But I think the reality of how us as sort of patients can influence things, I think that is a very powerful way. And we've seen time and time again, some of those innovations be very successful.
But that's the thing with healthcare systems around the world. I mean, you want to build this perfect healthcare system, but at the end of the day, you have to be agile rather than just being reactive. I think what you mentioned earlier about being able to kind of incorporate and engage these stakeholders on all levels is far more important, because that way you're more flexible in terms of policies, in terms of patients, in terms of research even, because sometimes people assume that scientists out there are doing something, but in reality, the process is very much different than reality. So I'm glad that you mentioned also empathy and trust, and actually in a very unscientific poll that I ran on our LinkedIn, and I saw that most people think that artificial intelligence is going to be the next breakthrough in health tech innovation. But in reality, for me personally, this is not no one else. I think it's blockchain at some point, because data sharing and making sure that this infrastructure is laid in a way that is secure, that is very accessible, is far more effective into creating these mechanisms. So I'd like to hear I'm picking your brain right now, but I'd like to hear your opinion on what would be the next thing for health tech to ensure that this perfect system exists.
I mean, I think from a institutional level, if we think about how the system is organized, I think one of the most important things is that institutions be open to innovations and to be open to experimenting with doing things differently. And this is surprisingly difficult to do. Like, there's a lot of, business and sort of management theories that sort of describe how difficult it is for big organizations to be agile, like you said, or open and receptive to change. And at the end of the day, I don't think it's, the way they're set up, it's understandable. You're playing with people's health. And so that means you can't just go around changing everything quickly. It's like, it makes sense for better or for worse. But I think we're seeing more and more hospitals, for example, incorporate little innovation arms that the entire purpose is to sort of receive, test, and pilot ideas and then be able to deploy internally. And I will say that, if you think about a national healthcare system that is fully coordinated, there are very good advantages to that. But at the same time, sometimes you find that it's difficult to incorporate these things too. So I think it's a bit of a give and take about how much autonomy do you give individual institutions to test things, and how much, I guess you said, standardization of processes, as you said, you need to do to sort of ensure that care is maintained at the same quality across institutions. That's very sort of from an organizational management perspective. I think, you mentioned a couple of technologies, blockchain, you mentioned AI, and I think it's important to keep in mind why those are important. So I think and I'm an engineer, so I get excited when we talk about technologies too. But I think it's important to keep in mind that the whole reason, for example, why AI holds a lot of potential is that it may be able to better support clinical decision making, right? It can help doctors that are sort of overworked and have too many cases to look through to maybe point out certain things that otherwise we would miss. We're human. I mean, these mistakes happen all the time. And if we can correct them, then that's good. I think from the blockchain side, it gets at what we were talking about earlier. Blockchain, for the sake of blockchain, is not interesting, but it's only because it enables sort of more streamlined and smoother data sharing, which can then allow us to be more, for example, detect viral outbreaks sooner, right? If we all communicate better with each other. So there's specific benefits that each of these technologies offer, which I think is important to keep in mind when you think about implementing them.
So I know that you've prepared a little presentation for us today that incorporates all these, very broad themes, and you want to maybe share with us your prepared screen. Maybe do you want to go ahead and do that?
Yeah. Let me see how I can do this. Okay, cool. So let me see if I can share this. So these are sort of the three broader themes that I said we're just going to talk over. But I think first off, just to get everyone's opinion, I wanted, and I think there's going to be a poll going around, I wanted to get everyone's opinion on where you think, how far you think we've come in the last 200, 100, 50, and 20 years in healthcare. There are 4 different questions. And so the question is basically, how strongly do you agree or disagree that we've made significant improvements in those timeframes? So let's see, the answers are coming in.
Everyone vote on the poll.
We're all working with technology, so bear with us if there's glitches.
All right, so in the meantime, we're waiting for everyone to vote for the poll, and then we'll be able to see the results. I personally think that it quite improved, obviously, drastically during the past 200 years.
As someone who works in healthcare, thank you, because you'd be surprised the number of people that that be like, no, we haven't made much progress. Okay.
All right.
Good. So mostly agree. That's refreshing. And I think we'll send another one out in a minute. But yeah, you're right. I think just to give perspective, the last 200 years, 200 years ago, the gentleman on the left, Dr. Semmelweis, was a Hungarian doctor that first suggested that it probably is a good idea for doctors to wash their hands in between delivering one baby to another, like going from sort of pregnant mother to pregnant mother. And he was basically scoffed at the time. He basically said, everyone said, you're crazy. You don't know what you're talking about. This idea that disease is transmitted by little things that you can't see. They literally locked him in a psychiatric institution, basically. So, it wasn't until Louis Pasteur came along that he actually said that, yes, he confirmed that was indeed the case. We're able to see them. And then everyone, basically 100 years after the original theory, said, yes, we now believe what this guy was saying. So things can be slow to improve, but we really have come sort of a long way in the last 200 years. So how about 100 years ago?
All right, so maybe we can go ahead with the next poll.
Yeah, I think it's out. Okay, also agree. Yeah, I think the last 100 years has seen us sort of improve our ability to record electrical activity in the body. On the left-hand side is sort of what the original EKG looked like, and now we know that we can carry it around carts around the hospital. The last 100 years has also seen the development of insulin. So, for example, for many diabetics, honestly, diabetes was essentially a death sentence. And so our ability to produce insulin and be able to administer it to people has been a lifeline for many, many, many people. So again, 100 years, I would say agreed. So let's see what 50 years. Okay, we're starting to get the disagrees. Good. All right. Yeah, I'll say that in the last 50 years, I would argue that we've actually made advances in a different direction. We've developed new drugs for cardiovascular disease. If you look at, this is a plot showing number of deaths per 100,000 people in the world. And you can see that around basically 1960, we started actually making this inflection point of heart disease coming down. And that's in large part due to a lot of our understanding, but also new drugs that we've developed for this. So saving a lot of lives. Let's see, 20 years. I hope we save this data. I think I'm going to use it in the next talk of just showing what everyone's opinion is.
We'll make sure you get the results. Yeah. I think the more data, the more information you have, the more disagreeing you'll have, because the lack of innovation, lack of progress on all fronts.
That would be very interesting, actually.
Yeah.
Okay. Yeah, we're getting there. I would say 20 years has made a huge difference, honestly. 20 years has seen us develop brand new therapies for cancer. Again, like understand a lot more. We're seeing immunotherapies and gene therapies coming forth. Again, saving lives where people otherwise had probably less than a year in terms of estimated survival. So I would say 20 years also made a difference, maybe in a different way, but still. And if you fast forward to today, that same EKG that I showed you, we're now looking at the advent of mobile devices, of digital health, of being able to sort of really personalize care based on people having instrumentation in their home to collect data and track their own health. And so I would say that from a technology and from a medical perspective, we have definitely made progress over the last 200 years. And even today, I mean, I don't think progress has slowed. I think that now, though, we are realizing that the problem is a little bit different. And so the main problem here is that health systems at the end of the day are still failing. And usually when I give this talk, I have to go into different examples of proving this, but I don't need to go very far this day and age. I'm just going to show headlines instead. And I don't think it takes much to convince people that, for all of our sort of medical breakthroughs, we still in many ways have been unprepared for this pandemic, resulting in really unfortunate mortality that simply did not need to happen. And so some of it does make sense though. For all the advances that I showed you, there has been stuff that has not changed. If we think about, for example, the very basics of how hospitals are laid out, that hasn't changed in over 500 years. We still put people, all sick people, go to the hospital in beds next to each other, get treated, then go home, even though we know this is not necessarily the best way. If you just see pictures from from previous pandemics, this looks very similar to what we see today. And the picture on the right, it's actually today, but it looks almost exactly the same as what they looked like before. And kind of getting to what we discussed earlier, Rami, the question of why is this way is simply that it's complex, that we have these sort of three fundamental players. We have patients, payers, and providers within this other network of other people that are all incentivized to improve healthcare, but in their own specific way. And so how you navigate this becomes quite difficult, and trying to introduce an innovation that is able to satisfy all these individual players is non-trivial. And so this is where hacking medicine comes in. So us as a group, just to give everyone a bit of context, we're a group that started roughly 10 years ago. And our main mission was try to teach healthcare entrepreneurship and try to bring people from different disciplines together to be able to tackle problems in healthcare. And our belief throughout is that you can do this through sort of good, simple, rigorous design processes. So we believe that good design can make jobs easier. And just to give you a really, really simple example, this is a sample of lab values that a doctor might order for a patient in the hospital. And you can tell that it's kind of difficult to read. You don't really know what's difficult, what to look out for. Do the numbers make sense? Like, how do I look at this quickly for many, many, many patients and not get sort of bogged down? But if we take those same numbers, reorganize, draw lines around them, and add some color for certain values, this can suddenly go from being, a 10, 20-second task to a 3-second task of just looking and immediately knowing what are the values that stick out, what do they represent, and what we need to do. And this goes beyond just sort of convenience. I think good design at the end of the day can save lives. And so there was one really interesting study that we always like to cite that looked at complications of surgeries around the world. And they found that you basically had complications for around 11% of all surgeries. You had infections at the surgical site above 6%, and 1.5% of all these surgeries resulted in death, right?
Wow.
And so they took a really just refreshingly simple approach. They said, these are sort of global sort of context. Technology is not the answer here. Why are we having so many sort of unnecessary complications? And they took inspiration from aviation, actually, and just developed a safety checklist. Literally just how pilots go through a checklist before you leave the plane, before you take off, before you land, for every stage, exactly the same thing. Before you put anyone under anesthesia, before you start your surgery, and before they leave, what are the things to check? And this simple sort of paper chart basically halved surgical site infections and death rate. No technology, nothing significant, just a matter of procedure. Again, to your point, Rami, about standardizing processes. So I think for us, we sort of have tried to encompass this process as a 4-step process. First, identify the problem, and I really can't emphasize that part enough. Second, break it down, build it up, and make it better, and then iterate. And this is not too different than other design thinking processes. I think we just sort of apply it specifically to healthcare. And so I'll run through one very quick, probably our most successful example of this, and that is a company called PillPack that some of you may have heard of. So PillPack came out of actually our very first event back in 2011. And the problem they try to tackle is medication adherence. And so we referred to this earlier. But people not taking their medicines are a huge problem. You know, they stay unsafe. They have to go back to the hospital. They're not as healthy as they could be. Once they go to the hospital, there's more costs, more tests, and it just kind of steamrolls. And so instead of trying to sort of, you know, have a solution that fixes all of these problems, they focus on a very specific target patient population. And that was blind people. They said, okay, at least in America, most of the meds that you get dispensed are put in these little cylindrical bottles. And what they discovered was that blind people that take two or more medications do not know which one is which. Very simple. They said, right, how can we help them? These are people that want to take their medication, but get confused and cannot do it unassistedly. And so all they did is basically reinvented the experience of taking your pills. Instead of putting them in bottles, they put them in a ticker tape with individual pouches, each labeled with your day and time. Basically, that specific pouch has all the medications you need to take at that time. You just kind of take it off, you rip it open, and then you take your meds. For people that often forget to take their medication, if they're not blind, they can also check basically what the next time is. So if the 10 p.m. version is not there, that means you already took the one before it, right? And so you can kind of get around the question of, did I forget to take my medications? And so PillPack has probably been our most successful startup, and we're very proud of them. In 2 years from our original hackathon, they've gone to shipping basically around the country. And last year they were actually acquired by Amazon for around $1 billion. So really simple concept, really targets a very pervasive problem. And so we've been fortunate to do these events, honestly, around the world. We've done probably over 100, 150 now. And we can count over 50 companies in just those 8 years. And I think they've raised a bunch of funding, worked with a lot of programs, but most importantly for us, actually had an impact on patients piloting and implementing their technologies. So lastly, I wanted to talk about sort of just broader emerging themes, but this might be a good place to stop as well, Rami, if you wanted to discuss anything.
I mean, I actually would want to stop or actually pause for a second here. And I'm glad that you mentioned design thinking specifically, because for a health tech entrepreneur, it's quite difficult to do some type of due diligence. And at some point, you're going to have to cross an ethical maybe, or some sort of a borderline that you can't cross to access data, for example, to do your own research. And I'm actually curious how you went through to spot the problem and recognize it in the early stages of developing this process. I mean, it's the essential, most crucial element of developing an impactful product. So I'd like to know more about that.
Yeah, I mean, I think the easiest question is go out there and talk to people who suffer from it. You'd very quickly, one of my favorite phrases that I've heard someone else say is that people are always hacking their own problems, right? Like you'll find that people always get around their own problems, and sometimes they've done it so much they don't realize it's a problem. And I think it takes a fresh perspective to come through and basically just reanalyze, ask sort of very targeted questions to individuals, just observe how they behave and observe why they do things the way they do to be able to understand. But to your point about, I don't know so much about ethical boundaries, you probably shouldn't be crossing those. But I feel as far as like disciplinary boundaries, I also agree that if you're not in medicine, it's very difficult to understand some of these things. You don't have context. And so I think that's why I can't encourage enough that it's important to engage very early on with the folks in medicine. That could be nurses, doctors, any sort of clinician really. And I think we're also seeing the reciprocal trend where a lot of young doctors are sort of coming in with the idea that, no, I've been taught things a certain way, but they don't need to stay that way. And I can actually improve.
Because the reason I'm asking actually is because sometimes we have a number of health tech entrepreneurs and founders applying to our startup competition. And one of the main things that they kind of lag behind is the due diligence, is the ability to do that type of research, to incorporate doctors. And I personally believe that it might be a bit of a cultural thing, or maybe people not wanting to be taking part of this experiment, or maybe they're just skeptic or not trusting to the system. And do you think it's a matter of a mind shift that is needed on all levels, whether it was the patients, whether it was practitioners, whether it was pharma companies? Because sometimes pharma companies would look at you and crush you at the end of the day. I mean, right now you mentioned Amazon acquiring Pillbox, but in reality, they just swallowed them. I mean, they could have easily developed it into something bigger, maybe. What is your opinion on that specifically?
Yeah, I mean, I think the reality of it is that with any venture, whether you're talking healthcare or not, you have your exit strategy as an idea early on. And so I know that, for example, in PillPack's case, Amazon is making a significant move into the healthcare space in general. And so, part of that sort of, I imagine, I'm not 100% sure, but part of that arrangement would probably be that you actually have to implement it and not swallow, like you said, the technology, right? And so I think as entrepreneurs, you unfortunately hear stories of people being acquired and then just kind of pushed to the side because you're like, oh, you were competing too strongly with us. Let's not. And I mean, that's where the ethical part comes in, right? I think the upside of basically that being your exit strategy is that these big companies can actually scale it much more. And so if you think about number of people impacted by your solution, I think it goes a long way. How you navigate that, I think, is tricky, as with most fields.
So that's a great segue to what I'm actually going to ask afterwards about emerging technologies and like specifically health transformation. What should we expect in the next 10 years to change? Because we kind of broken down the systemic overall healthcare system, how MIT Hacking Medicine does things, but what's next? Are we going to go back to a granular level of doing medicine? Is it you're going to go back to kind of very small scale health tech systems or more integrated ways of doing things? What are your outlook for that?
Yeah, no, it's a great point and perfect segue too, actually. So I tried, so there's obviously very broad shifts that are happening in healthcare, and many of these are sort of empowered and sort of enabled by technologies that we didn't have just a few years ago that are now coming out. And I tried to sort of really encompass all of them using these three sort of themes. One is decentralizing care, augmenting capacity, and then automating disease management. And so I will just briefly sort of go into each one of those and just give an example of what I mean. And you'll see that I'll be sort of placing each of the technologies in, within that specific theme. I think to the point of decentralizing care, like we saw earlier, I think, hospitals have existed actually since the ancient Greek time. So the Greeks were, I think, one of the first that proposed putting all sick people together in this building called a hospital. And we haven't changed since. There's no real reason why we put them all in the same place other than convenience and economies of scale. And so it makes sense from an economics perspective. From the patient perspective, if you or any of your loved ones have been in a hospital, I think we all know that oftentimes it's a rough ride. It's not going to a 5-star hotel and sort of relaxing and then going home. It's the opposite. And so I think part of the theme that we're seeing is actually how do we take all of these services outside of the hospital as much as possible, right? I think this really wouldn't be possible without a lot of these technologies that allow us to conduct telemedicine, that allow us to track data remotely. Without these, if you talk 20 years ago, we simply wouldn't be in a place to even talk about it, decentralizing care. And so whether it's sort of taking diagnosis, data, treatments, or even post-operative monitoring out of the hospital, I think all these are actually being compounded and emphasized by the current pandemic that we're experiencing. I think we've seen people become more and more comfortable with telemedicine visits. I know many doctor friends that have basically run their clinic completely virtually, sitting from home. And in a way, it's kind of forced us to experiment with it. And so these are some of the bigger companies that we have here, all of which have now sort of shifted to telemedicine, and their market basically has really skyrocketed the last few months because of the pandemic. And so without these sort of connected devices, we really wouldn't be able to do this. But now we're at a stage where we can actually talk about decentralizing care. And this isn't, I should say, decentralizing in the sense that these don't talk to each other, but very much that they remain connected, but without necessarily having to be in the same place at the same time. Go ahead.
No, I was actually going to give you the example of wearables and how now people are only having to go to the hospital because of the surgery element, if you're the expertise, the quote unquote hardware. But right now, like you mentioned diabetics, they can just wear a monitoring device and all the data would be automatically backed up in the cloud. And it's just outstanding that only, like, for example, I think 10 to 15 years ago, that was not possible. To have this data backed up and shareable and can easily be graphed without the use of any complicated technology. And I agree that decentralization is going to be the next thing in terms of war zones or any other remote areas or underprivileged communities as well. So this is another another way of looking at it. You know, for example, in places like Africa and Latin America and the Middle East and all that. And yeah, so I'd like to continue your presentation, and yeah.
Yeah, no, it's a great point. I think you mentioned two specific points of where decentralizing care, what it enables.
Yeah.
One, it enables easier access to care for people who are not able to access it. And two, it makes for more convenient care for many people as well. And so, I mean, even to your point about hardware, I mean, one real consideration that people have had in the last few months is, given sort of this COVID pandemic, obviously people have not wanted to go to the hospital, but people, for example, that require dialysis twice a week, you know, they don't have a choice. They basically have to go to the hospital. And yet these are people who are already sort of, you know, have pre-existing conditions, which might render them more susceptible to infection. And so, you know, I know a lot of companies that have tried to sort of now tackling with at-home dialysis. Basically, can you put everything on a truck and just kind of drive it around, and you go and you get your dialysis and you come back out? And so there's no reason why that can't be the case. We just haven't been forced to consider it up till now, because people, again, have been so used to this new norm that they never saw it as a, you know, as if there was any option. So, but with that, I think the second theme that we're seeing technology being really useful for is how we enhance and augment capacity. And this is to your point of delivering care, but also making care more streamlined. And so that means from a clinician perspective, allowing them to do their work, which is really patient specific, rather than sort of focus on a lot of the mechanics that could be sort of automated away. And you'll find that there's always a lot of redundancies that are built in. You know, the patient has to come in, they have to sign in, they have to wait in the waiting room, then they go see the doctor, then you see for like 15 minutes, and they go back out, sign out again. And all that, like this whole visit can just be like a 10-minute phone call in a way, right?
Yeah.
And so I wanted to give one example of one of the other companies that had come out of out of Hacking Medicine a few years ago, called Bodi Metrics. And so Bodi Metrics is a company that tried to tackle the problem of diabetic foot ulcers. And so older people with diabetes sometimes develop neuropathy, which means they lose feeling in the end of their limbs. And what that unfortunately means is that they are not able to detect pain in their feet. So you and me, if you, people who do not have neuropathy, if we walk too much, our feet will start hurting, we will stop walking and put our feet up. But that's the very basic loop. But if you don't know it hurts, it could very quickly sort of, you know, lead to inflammation in the area, lead to an ulcer. Honestly, when it gets, you know, pretty bad, you actually have to amputate, unfortunately. And so this is a really simple problem if you catch it early on, and really complex if you catch it later. And so Bodi Metrics' approach to this was that, what if we could actually predict when ulcers will form? And they did this by basically designing a mat. And what this mat did is that it basically mapped the temperature of the 2 feet. And they looked at individual temperature spots between each foot. And they were basically able to predict with surprising accuracy what might develop into an ulcer later. They would send this data to the provider, who would look at it remotely and then communicate back to the patient what the recommendation should be. Now, the beautiful thing about the solution is that the actual solution to, you know, a true prediction is don't walk. That's it. There's no medicine. There's no nothing. And so you're basically, it's not, even if you think about false positives, there really is not too much risk to it, right? I think the specificity, if I remember, was like 80, 90%. But either way, so they have sort of deployed really nationwide with the Department of Veterans Affairs to deploy this across hundreds of different hospitals for millions of different patients. And that's just one example of how you can use technology to actually enhance capacity of doctors, make things more convenient for the patient, and again, decentralized care, like we said. And so obviously there's a lot of different aspects of healthcare where you could, with different companies are operating to be able to, you know, do this. I think the last one, and this is something that is a little bit of my pet peeve, is sort of how you automate things. And so I think whether it's artificial intelligence and this ability to sort of acquire data from a lot of different sources that people carry around with them, it really has made that, you know, we were in data galore. Right? We have so much data that we can analyze, and we can probably make sense of it, is the thought. But I think the one thing I would just caution here is that we really need to do it with an intention, because there are honestly too many early stage startup companies that I see that basically their business model relies on, we'll collect data, we'll have something, and then we can, you know, make sense of it. And it's not, I mean, I think all the success stories that we see about actually data being able, you know, some trend that we can predict something else, that's the minority of cases. That most of the time there's a lot of data and a lot of it is noisy. And so you really need to go in with some specific intention of what you want to do with that data. And this goes, I think back to the initial framework that we discussed of how do you narrow down to a specific problem before you broaden out. And so the one example I wanted to give on this front is actually a recent company that came out 2 years ago of one of our events called Canary. And they tried to tackle the problem of earlier diagnosis for lung cancer and other respiratory conditions. And they had a really elegant sort of thought. Their rationale was, can we detect lung cancer from a cough, right? Is there a different signature between coughs of all these different diseases? And if so, do you just cough and your phone hear you coughing and actually tell you, oh, that sounded like a suspicious cough. Maybe you should go get it checked out, right? Super simple, seamless integration into your life, right? It's not, don't have to go anywhere. And in a way, you're erring on the side of better screening, which is a huge problem with things like lung cancer. So, just a couple of different themes, I think, similar to what we were talking about. And I'll just, and this is sort of just a list of, I wanted to specifically call out how COVID-19 has sort of changed things in terms of forcing us to re-examine some of these questions and themes.
So to complete the circle and to answer my initial question in the beginning of the talk is whether we can make the same comparison between 2008 and 2020. And I think right now we're still in the shock, obviously, and we're still trying to handle the situation. But I think now is the time to, we're examining the status quo, trying to, make up what lessons learned. And I think this is a very interesting experiment for us to, see the pitfalls of the healthcare system, as you mentioned earlier, and kind of if we need to be able to collect the data for a purpose. We need to break it down, and we need to establish those standard procedures all over to ensure the quality of the services being provided. And to wrap it up, I think from my end, I think what you mentioned earlier about IoMT, about augmenting services, decentralizing services, is crucial, but what is more important is collaboration. I think one element that I would like to highlight is the collaboration element. And right now we're seeing organizations across the world all putting their efforts towards finding the cure, for example. But if you could only imagine this effort is being made on an ongoing basis.
Yes.
Where do you see us right now? I mean, if you're in Boston with MIT working versus someone in China versus someone in Germany, you're all working together. How do you see that, accelerating innovation?
Science is an interesting field because in a way it is collaborative, but at the same time, there's very actual real competition, right? Both in the sort of academic realm in terms of success, but also in the commercial realm in terms of who can develop it. And I don't know, some competition is healthy, but I think what we are seeing, and just a very broad statement about technology, is that you're able to break down a lot of the barriers, geographical ones, disciplinary ones, in terms of talking with different people. And I think regardless of how much you want to compete, I think that exchange of ideas is extremely valuable. That it is extremely valuable to be able to talk with one of your colleagues that you've never, talked with before and share some ideas and have them give you feedback. And maybe it, blooms into a collaboration. I think it's interesting you mentioned this. So over the last few months, we've actually run a few virtual hackathons with some of the other groups and a huge consortium of partners. And it's actually been incredible. We've had more teams continue working after those events than we have after our in-person events, which was something surprising to us. And I think we got applicants from like 142 countries, and basically it's an entirely virtual thing that people work together. And it's been very beautiful to see people, sort of wanting to engage. And so I think if there's, one small positive that has come out of this pandemic is that it's energized everyone in a way to get involved in healthcare and to want to contribute. Right. And so that first part of the talk that I have to convince everyone of why healthcare is your business, I can get rid of that now. I think most people understand it. And so because of that, you're seeing just very naturally organic movements towards, sharing ideas. I remember I was working on a project for open source ventilators, and I came across this, Word document, this Google document, that had like probably 200 pages of shared between thousands of people, just everyone putting in their own ideas. And so I think it's good. And I think what we should aim towards is how do you actually streamline and make those efforts cohesive to avoid sort of a lot of noise and a lot of, honestly, inefficiencies, if you want to call it that.
I'm very glad that he actually wrapped it up this way. I think we have a few questions from our audience. I think we still have some time to address them. So we have one from Zainab Atwi. Where do you think AI will be the most important in health tech and healthcare? And what do you think about 5G technology and nanotechnology fields? So however you want to address that.
Yeah, three different, although I guess kind of related things. So I'll take AI first. AI I think, has a lot of potential. We've saw in the last few years, there have been papers that have come out showing that it can be sort of used to support diagnosis of melanoma, used to support radiographic analyses of different X-rays, of CT scans. And so in a way, some people are sort of say, will AI replace doctors? I don't think that will ever be the case. I think at the end of the day, we need doctors. And in a way, there's a funny story parallel to this that I always think about. So when the thermometer was first introduced 200 years ago, all the doctors said, this is ridiculous. Why would you have a machine tell you the temperature when it's my job? I should go and put my hand on your forehead and tell you if you have a fever or not. Why do you need that? And I think it's a similar parallel. We're sort of seeing how this technology can support and enhance decision-making. I don't think it'll replace completely. If anything, I think it'll make it sort of a more streamlined process and hopefully makes everyone's lives a little bit easier. I think 5G and nanotechnology. 5G, I think the biggest relevance I see is in terms of connecting data and being able to share really large files efficiently. And so, I mean, I think 5G is a huge leap ahead of what we have. But as usual, I think it'll take a while for it to trickle down to medicine, because you'll need to sort of incorporate different privacy and confidentiality considerations as well. And then nanotechnology is extremely broad. I think there's a lot of sort of research, and it's been going on for probably 10, 15, 20 years at least in terms of how nanotech can change medicine. Sky's the limit there. I think we are already seeing some medicines that have certain nanotechnology features incorporated in them, which allows them to better target specific sites and allows them to, better treat disease. But it's also, as with anything, I would say, new technologies means that we don't always completely understand the safety profile. It'll probably be another few decades before we fully understand the long-term effects of that.
We actually just got a new question from Ghinwa Al-Hayek, and she wants to know, how can we apply telemedicine in low and middle income countries where most of the community that need care, example, the elderly, and underserved communities, example, refugees, might not have access to stable internet connection or not even a connection at all? Wouldn't this raise a big inequality issue, the same we are seeing with contact tracing apps representatively?
Yeah, the short answer, that inequality is going to exist. But the good news is that there's actually a lot of global health type of startups that try to use telemedicine at a simpler approach. And that is actually just using mobile phone texting. And so there's no reason why you could not sort of consult a nurse using a phone. And there's actually a startup in Bangladesh, I think it's called Tonic, that they actually partnered with telecommunication companies to basically offer, I think, a certain number of minutes or visits for people to call an on-call nurse to triage problems ahead of sort of going into the hospital. And so I think it definitely poses difficulties. It definitely limits what you can do. But I think people have tried to sort of, not forget about obviously those populations and be able to try to serve them through different mechanisms. And there's been some success around, and I know a couple of other companies for refugees as well. But in terms of how you actually try to deliver care, I think most of them have tried to use mobile phone connections as well.
Actually, I want to add to her question, specifically in terms of inequality. Where do you see the role of policies and leveling the playing field specifically for those communities? Meaning, do you see the need for new digital policies for digital health? Because right now we see a lot of these policies are set back in the previous century, and now we're kind of adapting to new ways of doing things. Do you think these policies would alleviate the situation or make it worse, or no difference at all?
I mean, I think they should make it better. I think I'm not a policymaker by any means, but I think the general thing that we're seeing is that policies are not necessarily up to date when it comes to the digital world. And this, it comes in with patents, it comes in with sort of how you regulate the space. And I think that is sort of something that is being discovered. I absolutely think policies need to take the inequalities because it's a very good consideration in terms of where these technologies, go to. What the best way to do it, what to prioritize, I'm not 100% sure.
And actually, we have one more question from Zainab Atwi, and I think this will be it for today's panel. It's other than design thinking and the knowledge of the standards and ethics of the health field, what also should we know as entrepreneurs? So if you can give her like a tweetable sort of a title that she can use.
I'm going to actually just show this because those are sort of if I had 4 bullet points to tell entrepreneurs of how to approach anything in healthcare, it would be these 4. It would be seek context, tailor your design, get fresh perspectives, and just know that resistance is going to exist. The guy that suggested washing hands was put in a crazy asylum. Thermometers were seen as threatening to, doctors' jobs. You're going to find this regardless. And so I think the earlier you can anticipate and plan for it, the better.
Well, Dr. Khalil Ramadi, I think we're out of time today. I really want to thank you for your time and for your effort in presenting this very eye-opening discussion. It was a pleasure for me and to kind of get to know these new themes, new fields of study. I want to thank everyone who attended today. And if anyone has any question or wants to view today's discussion, they can log in and they can watch it on our platform. Dr. Khalil Ramadi, if you have any last words for our audience today.
Go out there. Honestly, I think healthcare is not as challenging as it may seem from the outside. I think a lot of the way that we do things is the way because it's just been done that way. And you'd be surprised about how many times, just if you ask the question of why is it you do that way, can we do it better? You'll be surprised by the answers and about the opportunities that exist.
All right. Thank you so much again. I really appreciate this. For everyone attending, make sure to join us next Wednesday for another webinar, part of this, the Boardroom Webinar Series titled How to Safeguard the Ecosystem. It's all about resiliency measures and how to mitigate all the impact that we are actually living during this time and age. I really want to thank everyone for joining us and have a great day ahead.
Bye-bye.
Bye, Khalil. Bye-bye.